Hello, everybody.
Hey, Colin. Hey,
How's
everyone.
it going?
Hi,
Good.
Colin.
Hi.
Let me see.
Hey, this is Herman. I'm joining by phone. I'm experiencing some computer performance issues right now. I'm trying to get logged in by through the web link, but it's right now not working.
You know, this is like my third Zoom meeting this week, and there have been several where people seem to be having internet access issues. I think we're tiring it out.
Can everybody see the
I think
agenda?
you're right.
Yep.
Great. Okay, Herman, it's 1:01, so we can start whenever you're ready.
All right. Well, as soon as I can get something to work on my computer.
Okay.
Could we do a roll call or something so that I
Yes.
can know who's actually on the call?
Yeah, call the meeting to order and then I'll do the roll call.
Okay,
And then
I'll
we
call
can
the
wait
meeting
for
to
you to do
order.
it. Okay, I'm gonna do a quick roll call. Dr. Snyder,
Here. Hi, everybody.
you there? I see Dr. Conroy. I see Herman.
Here.
Yep. Is Dr. Haushen on?
Hi, I'm here.
Okay, great. Dr. Gurka, Dr. Busey. No. Patricia Carroll, yes. Roger Doles. No. Dr. Naima Brown. I saw her. She's here. She might be on mute.
I'm here. Thank you.
Yep, there you are. Okay. Dr. Fogarty, I saw her. She's here. Dr. Resende and Jeff Feller. Some of these people might be late, but I think we have a quorum. 1, 2, 3, 4, 5, 6.
Okay, what's the next item on the agenda?
The next item is the minutes from May 8th.
Okay, do I hear a motion to approve the minutes from May 8th?
I'll move. This is Pat Snyder. I'll make a motion to approve the minutes from May 8th.
This is Naima Brown. I second.
Okay, motion and a second.
All in favor?
Hi.
Aye.
Aye.
Any opposed? Motion carries. What's the next item?
The next item is it's basically the draft report and the discussion of the indicators. So however you want to do that, if you want me to put your report on the screen, if your computer's not working, or if you had any survey results, or however you'd like to proceed.
Yeah, why don't we, we'll go quickly through the draft report that I sent you, Colin, yesterday, to share folks some of the changes that we made in response to the feedback that we got. And then once we've done that, I don't want to spend a lot of time tweaking that because I'm going to ask for feedback after we go through the SurveyMonkey results.
Okay, can everyone see the report on the screen?
Colin, can you put it in presentation mode so it's a little bigger?
Yep,
Thanks.
I'm just
Okay,
moving
so
stuff around on the screen. Yeah. Oh, God.
My screen is not updating, so it's, oh, there we go. I think I got it now.
How is that?
Thank you. That's much better.
Okay. And Herman, I guess I have control, so I'll click through, and the clicking is a little bit slow, so we'll just do the best we can. So the first, what's on the slide now is the committee members.
Okay, and so based on feedback that we got from the group, we've added affiliation. If you folks that are on the call, if you could verify that we have it written or identified the way that you would like it displayed, and then we also removed doctor from folks that were listed in the left-hand column previously. The two Children's Trust board members, we added an asterisk to indicate that you guys were also on the board.
In my feedback on the PowerPoint, I had just put it in alphabetical order.
I didn't receive any feedback from you, Dr. Houchin. So if I'm not sure that we would have incorporated that.
So Herman, I sent you Dr. Houchin's slides, and so I'm assuming I don't know where if it was written out explicitly or if maybe she reordered them on the slide, but we can certainly do that.
Yeah, I mean, I received the PowerPoint, but I couldn't detect and certainly don't have the time to go through every slide to review changes to make them on the master slide that I was working with from everyone. So I apologize for that. I just, that's why we asked at the last meeting for folks to just send their feedback on the PDF that we sent out, so it would be easy to see the differences. So I think listing in alphabetical order is absolutely fine. There's no other order other than how they've been listed in other documents. You can go to the next slide, Colin.
Okay.
Did May Quinn say she wanted to get off the committee?
She did, and we discussed at our last meeting that since she has been an active participant through all of our meetings up to this point, it seemed appropriate to still include her as a member that has contributed to our thinking on this.
Oh, I agree. I would want her to be on there, but I thought that she resigned at this late date to disassociate herself. So we might want to ask her if she wants. I thought she didn't want to be, so I just want that clarified.
That's a good point. Colin, could you reach out to Dr. Quinn or Professor Quinn?
Yes.
So I made comments all the way through. I apologize. I was not at the last meeting, so I was not aware that the preference was to send comments on the PDF. So I requested the original PowerPoint from Colin and made changes to that PDF. And then Colin asked me to note those, and I have not gotten around to it. I apologize. So I'm going to not make all my comments, as you go through it, just to respect the committee's time. And if it's possible for me to still send in my highlighted PowerPoint, I'll do that. If not, if you'd prefer to just go forward with how it is, I'm okay with that as well.
Well, I think that we're going to need to make changes anyway based on the data that we got through SurveyMonkey, Deidre. So I think that if you just send that to me, we can incorporate your changes.
I thank you.
Okay, we can go to the next slide.
Okay.
All right, and so this is unaltered visual to remind the trust members of the RBA framework.
Yeah. And by the way, I'm clicking. It's just it's not moving. So give me just a second. It's just really slow. I'm sorry. Would you mind if I can expand and make the slide? So it just seems easier to click through if I do it like this. So I will expand it now. Was there anything?
Don't worry about it, Colin. Don't worry. I can still see it.
Okay. So we're on this one now, Herman.
Okay, so this also is I think that the description that Colin presented to the board at the last meeting of the key vocabulary for guiding RBA in our process was helpful, and thought that it was meaningful to include the slides that he shared with the board at their last meeting again in this PowerPoint, and so that we added that slide in.
Activity slide.
Yeah, I can't.
Okay.
I'm not seeing the activity slide.
Okay.
And so there was some feedback that folks wanted to add some additional activities to this slide, but am at a loss for what else we would want to say other than we met consistently and collected and prepared available data for the presentation. Did anyone have some other specific activities that they would want included on that activity slide?
Herman, this is Pat. One thing I think might be helpful is, and maybe it's in the first bullet, but it might be helpful to say that a number of people who are on this committee went back and did additional research and about some selected areas and brought that back to the committee.
Yeah, I think
Okay,
Herman, this is Maureen. I think I also made that comment that it might be helpful because I think there were a lot of data sources that were reviewed, right? So it wasn't just meeting, but looking at different sources and different resources to get data. So how we identified the meaningful indicators, I think.
Right, so like kind of listing those reports that contained county-wide data, kind of that we discussed at our early meetings.
No, I think what we're suggesting, Herman, is just to say that individual members went and did additional research and brought that back to the committee for their consideration. Deidre sent a lot of stuff. Patty did. We sent some stuff, right? Maggie did.
Mm-hmm.
Yeah, I think that's an important thing to add as well. And I come back a little bit in regards to that, to the slide where you list the members, and I've been sort of thinking about that a little bit because you list affiliations, which in some cases make the expertise brought to the committee pretty clear. But where it doesn't, and I was thinking about that because it just says Children's Trust member, but I'm a clinical psychologist, I'm a retired mental health, behavioral health CEO. So I think somehow for those affiliations that don't necessarily make clear what the expertise was, that might be good to highlight. And I don't know if anybody else felt like their title or their affiliation doesn't reflect it, but I think that might be, because it ties into
So-
this, right? Because those of us who went off and researched other things were doing so within our scope of expertise, our sphere of expertise.
Yeah. So Maggie, you'd like to just what would you want us to list for you? You know, the retired CEO?
The retired behavioral health CEO, yeah. And put in,
Okay.
you know, so the psychology part is sort of less in some ways. I haven't practiced in too many decades.
Okay. I think it's easy
I just-
adjustment to make.
I just dropped some language in the chat. I wonder if it might be helpful to expand this conversation about meaningful indicators to include a framework. Because when we're talking about results, indicators, and then data sources, and also, you know, yeah, we talked about more than just, so that language to me seemed to be a little bit more broad. Tell me what you think. And I left off, when I left off at that's well-being of children and families in Alachua County.
Yeah, I like that language actually.
Yeah, I like that as well. Yeah, we can add that in here, Deidre. Thank you.
Mm-hmm.
All right, can we go to the next slide, please?
I love these. Good work, everybody. I think we came up with great results and worded them well.
Okay, so we'll go to the next slide.
I would like to just go back to that last one. Instead of saying if, I would prefer we say when. It's a small thing, but it makes a difference.
That's a great suggestion.
Yes,
Any opposed?
totally agree.
Hearing none, we'll change if to when. What slide are we looking at, right? Or what slide do you guys see? Because I'm clearly having a computer lag in what I can see.
We're seeing the Florida Department of Health resources for long-term indicator tracking. So you move those up to the front, I think, which is a suggestion some of us made, right? So.
Yes, yeah, we move that to the front. And then we also explain at the bottom that on the listing of indicators, which you'll see an example of this on the next slide, we put an asterisk by any of our indicators that are also similar or appear exactly in these other Department of Health products. And then where there's overlap, we also have added a little text box in the corner of each slide that indicates the quartile of Alachua County performance in that indicator, in either the first or second, third, or fourth quartile, which was the suggestion from the, I think that was from you, Pat, at our last discussion in the meeting.
Yeah, and I think it'll be helpful when we present this because both Ken and I think both Ken and others, Lee, were asking and others were asking where we stand on these things, right? Relative to other parts of the state. So I think that's.
I'm just asking a clarifying question. So is the purpose of this slide where it is to help the community understand that there are these core longitudinal sources of data that we can continually rely on?
Yeah, and that we can spend more time and effort going deeper in the qualitative area like we had talked about previously, right? Yeah.
Great.
Okay, if we move to the next slide, which is the
Yeah.
all children are born healthy.
Yep.
Also, as a recommendation, we've reorganized these to fit into age bands to make that a little bit clearer. And you can see the asterisks for the indicators that are represented in both the Department of Health products as well as our reports. And we can go to the next slide. And yeah, just go to the next slide.
We're on the dental health slide now.
All right, well,
I would,
I can't see that.
okay, the dental
Go ahead.
health, I
What-
would
get-
request that it is Dr. Scott Tomar, but he's no longer with UF's College of Dentistry.
Yeah, and that feedback came up in the SurveyMonkey, so we'll talk about what the longevity of these data when we get to the survey.
Thank you.
And so what you guys will notice as we go through these indicators, any of the indicators thus as we go through the document, as we can, we've identified the same scale for the y-axis. So for all of our percentages now, those are to 100%. And for some of the indicators where the percentage is really low, that'll be reflected here. And if you go ahead 2 slides, I want to share an example of the overlap between Department of Health data and our indicators.
So we're on the slide that says insured children ages 0 to 17.
Okay, and so you guys will see in the top right corner, we have our Alachua County performance as described on the Department of Health products, as well as the direct data poll that we did for 15, 16, and then 18 for those data that were available in Florida Health Charts, showing Alachua County versus Florida percentages. You see on that one, we actually are looking pretty good, which is great, that we have both some validation of that good performance in the first quartile performance rating, as well as we're ahead of the state consistently.
Herman, I think when we
Yep.
when we present the data, I think it will be helpful to say, by this indicator, we're looking good. But what we have to think about is the story behind these data. And just because children are insured doesn't mean they all have access to a medical home or that they're getting consistent care, right? So,
Well, Pat, you
just-
actually are raising an important point that I want to make sure I mention now before we get off the call today, depending on people's schedules, is that I once we kind of agree on the format of the presentation and the indicators that we want to see reflected in the presentation, I would like to do a practice run through and would love feedback from anyone here on that run through before we actually present this to the board. And you know, I'm not sure of everybody's time availability and commitments to be able to participate in that, but would want as much feedback and participation in that practice run as possible. To really get into the nuance of describing each of these indicators in a way that the board will relate to, because we have the potential to have a lot of data and a lot of information that we're sharing is I think the way that we communicate the information is going to be very important to make sure that we don't lose interest among all of the board members as we're going through this, and to appropriately highlight the things that they need to be focusing their attention on as we go through these indicators. And I think that some of our indicators we're doing well as measured by this, but as you've identified, Pat, it doesn't necessarily mean kids are using the services that they have access to. It just means that they're insured.
Yeah, I totally agree with Pat. And my reaction on a lot of the SurveyMonkey items were that I thought there were things that we had that would be better used to tell the story than to necessarily be a primary indicator.
I've still got some questions around this language of indicator versus data. So straighten me out if I'm wrong here. My concern is what we're showing is sources of data or data that is an indicator to something like so the data around dental health, for an example, is an indicator as to whether or not children have good oral health. It feels as though that language, all children should have good oral health, or children's oral health should be something that's the indicator. And then the data that follows after it is a different thing entirely. That's the data, and it indicates something to us. But if we get into the place where we're talking about the actual data as the indicator, it's left up to the community to interpret, which sounds like what you all are getting at. Like, we're going to help them interpret the story. But it felt to me like we missed doing that work of naming the indicators for them outside of just labeling what the source of data was. So what do y'all think?
Colin, can you go back and do a little bit of a narrative about the slide that Herman showed at the very beginning? It's that you presented at the last trust meeting. Yeah. So I think, and you can correct me if I'm wrong, Colin, but I think, Deidre, that the result is under whatever the first result was, all children are born and remain healthy. And that's the result. Mm-hmm. And then the indicator is the measure that helps qualify that, right?
I have a question, Dr. Halshin, and everybody. Did you have a chance to take the survey that was sent out, that Dr. Kanov sent out?
Yes. Oh, yeah.
Okay. So I think what you're saying is, basically, the way I hear what you're saying is that the data on oral health may not be a really good way to indicate whether or not a child is actually healthy or not. So I would, as an overall communication, I gave it, that's what I hear. And is that accurate, or am I missing what you're saying?
No, it's not that, and I could be very wrong, but I think what I'm saying is that there should be, when we're looking at indicators, those are still, they're measures. So, but we need to name it a child's oral health and give some explanation as a facet of their physical health, so that it's not, that indicator is not the same as the data that is traveling with it.
Yeah.
Data sources might change, we might add more data to it, but there's an actual indicator that stands, and that people who are not quantitative minded can get their head around, like, oh, these are the list of things that they're saying are important under this result.
And I agree with Dr. Hausch, and I think I get what you're saying. It's just that these measures are the indicator of the oral health of children, which falls under how well are we doing. So all of those things that are on that page, cavities and so forth, are about oral health. And she's saying we labeled them, but perhaps just an explanation, maybe. And it might come off in the presentation that will be given. I do think, as Colin mentioned, that in the survey, it was very clear. As we took the survey, oh, you're telling us about your impression of these measures on these 3 different areas.
Colin, can you go to slide 10? Because, so I think that this may be an opportunity, Deidre, to expand a little bit as we talk through the slide. So so why are we concerned about dental? Well, because untreated caries and the number of caries and sealants and all of that is predictive of all kinds of other health outcomes for children. And that insurance is the gateway to access to care, knowing there are other things that actually impact it. So I think that what you're getting at will reside is in the discussion when we present slide 10.
I completely agree. That's what I was thinking about exactly. That this is where, in childhood span, oral health would be one thing. You know, insurance would be another thing. If there's another category under there that we're talking about in the data agenda, maybe it would go there. But these need to be organized a little bit more so that the average person understands the connection between what we have in terms of data and children's actual lives and why we think it's important.
Protecting your health against the coronavirus, also known as COVID-19.
Oops. Somebody's got something else in the background.
It just sounds like you're saying to me there's a lot of domains when it comes to health, right?
Yes, you got it.
Yeah,
You got
okay.
it.
Well, that's easy to, yeah, I agree. Yeah, and so this just breaks it up and gives domains for, yeah. Okay. I forgot what slide we were on. Dr. Kanov, what slide do you want us to go to next?
I
I
think you
let's
were
go
at
down
health
to,
insurance.
Okay.
yeah, but I mean, I think, I mean, I think that, I mean, for the most part, the rest of this section, it's the same data and information that has been reformatted. I want to spend some time looking at the education data because I've done some major organizing of how we're reporting those to aid in clarity as we're looking at it to help see some of the pattern differently, and would like to get feedback on those to decide a preferred way. So if you could scroll down to I guess the first one would be the
I'm on it.
early childhood.
Yeah, all children can learn what they need, and you have it broken up into 2 different domains, early childhood and school age.
Okay. And so the first thing that I want to talk about is the child care access. And whether or not we view this as part of the story behind the story, or if this is a community level indication of children learn what they need to be successful or not. Is that I mean, this is my work. I spent a lot of time studying this. And so I of course, am going to think that this is important. But as I reflect on this, this seems to be more a mechanism that, or access to service that supports kids in learning what they need and being successful. And wondering if this is something that we want to retain here, or if this is something that becomes part of the story behind the story package if we identify early learning as an area that the trust needs to focus on.
Can you describe what I'm looking at with this heat map? Because I don't know, I see the index, but I'm not sure what all positive selection infrastructure, all negative means.
Yep. So for the Florida Index for Child Care Access, we get data from the Office of Early Learning at both the child level as well as the provider level. And we first, for selection, we look at the extent to which kids are enrolling in high quality care when that high quality care is available in their area. For Alachua County, because we don't have any other systematic approach for evaluating the quality of providers, for the data series that we're looking at, quality is being identified as participating in the Gold Seal program. And so providers have become accredited by one of many potential accrediting bodies that are approved for Gold Seal status in the state of Florida, and receive additional subsidy for Gold Seal participation and achieve nonprofit status. But that's the indicator of quality that's being used. So for selection, we look at the proportion of kids that are enrolling in high quality care based on the proportion of high quality care that's available in the area. And for infrastructure, we look at the capacity within the zip code to serve kids based on the expressed demand reflected in school readiness enrollments within the area. So in areas where infrastructure is negative, this is a very pronounced imbalance in supply and demand, because we also understand that school readiness enrollment is a relatively small proportion of all kids trying to access quality services. So in areas where we have more SR kids trying to access services than there are slots available, that represents a serious problem of capacity that needs to be examined or looked at. So when we're looking at all green, both selection and infrastructure are positive. When you look at the areas that are kind of the dark orange or red color, we have inadequate infrastructure, which is preventing parents' ability to select or enroll in high quality services. The light green area has negative selection but positive infrastructure, indicating that we have ample infrastructure for families to enroll, but they are not enrolling, which there are a number of reasons why that might be the case: cost, logistical soundness, available hours of care are all potential impacts on families' ability to enroll in care that may still be available. And then in areas that are yellow, we see positive selection but negative infrastructure. And so that we don't have adequate infrastructure to serve the demand within the area. Despite that, families in the area that are using school readiness services to access care are enrolling in high numbers and high quality providers. The heat density map that you're seeing overlaid on top of this map shows the child density of children who are participating in the school readiness program. So the darker pink or hotter looking areas have a much denser grouping of school readiness kids. The areas that are like yellow clouds has a moderate density. And then the areas where you don't see anything, it looks completely transparent, is that there's no clustering of kids together that are using SR services in the areas. So as we're looking at this map, the way that the early learning coalitions throughout the state are using these data is to identify areas that are either yellow or light green first, to understand the pattern of parents' enrollment in high quality services, and to identify where they need to incentivize provider participation within the system. The next map complicates the map visually and actually plots all of the providers that are operating within the coalition by quality status and status as a school readiness provider, is that it's not required for providers to offer school readiness services. And in fact, in Alachua County, we have some providers that are accredited and providing high quality services, but have elected not to serve school readiness kids. So that might be an easier lift to increase infrastructure in areas where it's low.
You asked for feedback. I think it's incredibly valuable and crucial to the story, and I would appreciate if we included it. Good work, Dr. Knopf.
Yeah, my reaction is that it has the same value as are you insured or not. Because
Yeah.
if you can't get into adequate childcare, if there isn't high quality childcare available to you, the leveling effects of good childcare on all kinds of kids that come with challenges is not there, right? So we know early childhood has a huge leveling effect. And so it's like having insurance. To me, it's yes, belongs right here. That
Okay.
said, the other question would be, is kindergarten readiness, go back up to 29, Colin, which is the list of the, so yeah, so kindergarten readiness, one hopes, is what happens when you have all of those other things. But if those things are not accessible, I think then that tells that's a very powerful indicator.
And then the next slide on here. Well, one thing that I want to mention, and again, I'm not sure how much depth we really want to get into this part when sharing this with the trust board, is that this is a picture from June 2018, which is the most recent data poll that we have that's credible from the Office of Early Learning. But recognizing that COVID-19 is having a potentially devastating effect on both the demand and supply side of the marketplace for early care and education, is that what we're looking at here is not likely at all what we will be looking at in August or June of next year, because there's been significant change both in parents' willingness to enroll their children in an environment that's outside their home, as well as the capacity within providers who are following the CDC guidelines. But then also we may have permanent capacity loss as providers try to weather the economic storm of not having income, but still potentially trying to maintain their infrastructure, such as building costs, rent, insurance, employees, and the like.
Dr. Knopf, I do want to add, I think you bring up an excellent point of the expediency of this group and the work being done, because tracking this is vital, and then we can see how changes have resulted or changes that have occurred as a result of the pandemic. So I think that's crucial, and then we can see different levels of functioning over time and how to increase in spite of the challenges posed. So thank you.
Mm-hmm. Yeah, at some future date, I hopefully will also be able to share some additional indicators that we've been working on during the COVID-19 pandemic to look at the stress on the childcare infrastructure reflected in by program closure, but also are working to identify characteristics of resilience among childcare providers that we might be able to identify later as we continue our analyses in September, October, November, to see which providers were actually able to weather the storm, considering the kinds of supports that they've been able to receive from either the Triple P, which I think is a pretty low number of providers in Alachua County, but also maintenance of income through the VPK program and school readiness subsidy, which are all being maintained regardless of child attendance through the end of June. I was just on a call with OEL on their ED meeting this morning, and that policy is likely to change at the end of June. And so that the income that providers will be receiving will drop pretty considerably if enrollment doesn't pick up in July. But I don't want to take all of our time talking about these. So the next series, and I need advice and help on trying to come up with a proportional measure for school readiness, VPK, and Head Start. So for VPK, right now, we've used our kindergarten enrollment data for as reported at our kind of our early enrollment data from the Department of Education as our denominator for the VPK in 1819. And so we're showing almost 76% participation of in the VPK program in Gainesville. There are limitations in using that kindergarten enrollment data. Is that there are plenty of children. We're not sure how many, but there are plenty of children that enroll in VPK, but then go to private school or continue on at the private school where they were enrolled in VPK, and therefore would not be captured in our denominator for kindergarten. So that proportion is not going to be absolutely accurate, but as long as we're comfortable with this being the best we can do with the available information. With regard to SR and Head Start, that's difficult to disentangle because SR covers a much broader age range. So SR through policy covers 6 weeks through 13. So that goes through elementary school as a service that's able to be provided as they provide after school care and services through the school readiness program. But it's only for families that are below 150% of the federal poverty line, up to 85% of state median income to remain eligible for those services over time. So that's a difficult number to identify based on the available data that we currently have. That would be, I think, because I don't want to rely on census estimates or American Community Survey estimates because those I don't think are really appropriate, and we're not sure how accurate those estimates are when we're trying to do something with such a small population of, kids that are eligible for the financially eligible for the school readiness program. But it's not just financial eligibility. So you have to be below 150% of FPL, but also working or in school, which complicates constructing that denominator that much more. And between Head Start, VPK, and school enrollment, or the school readiness program, there's a lot of overlap. And so one child could be enrolled in all three. And in fact, at the Child Center, we have children that are currently enrolled in all three programs and would thus be double counted if we were to just aggregate these data together. So with all that complexity, I'm not sure what to report. If we just want to report VPK program, because that's confident we can report that in terms of the percentage of kids in Alachua County that are accessing that service. The others, it's more complicated.
Why don't we report wait lists? That's what everyone else reports, school readiness wait lists. That's an indicator of availability or not. Why would we not do that? Because what the Early Learning Coalition or someone's going to ask for is resources to reduce the wait lists, right? So is that not a good indicator? Or
I mean, it's not bad. I think that if funding is the reason why we have a wait list, then I think sure. Operationally, I'm not sure if funding is the only thing that is resulting in a very high wait list in Alachua County. Processing time, parents' difficulty in navigating the online system, and even awareness is actually limiting the number of parents that are accessing the wait list and getting their name on. And not due to necessarily to current operations, but in the past, the Early Learning Coalition was not known for a light or kind touch with families that were trying to access services. And so I think that we also have a number of parents that would qualify, but are not willing to interact with the agency due to reputation that was established, 10 years ago. But if we want to share this number to secure additional resources for the coalition to provide additional subsidies to kids, then absolutely, waitlist will motivate that kind of action. And so I think that if as long as we understand why that number is important, and that's what we share, is that,
well,
there are funding constraints.
So the two things, just for me, I'm not on the committee, but the two things that I just, I don't know how you don't report wait lists, because everywhere I've ever been that's reported about early learning in their community always reports wait lists. And like you said, the reason may not be funding, so that would be interested to investigate. The other thing is I didn't see anywhere, I think for those of us that are not subject matter experts, you need to, someone needs to explain why there's no school readiness measure on here, kids ready to start kindergarten. Because, you know,
There
when
is.
you
It's on the next slide, Colin.
it is? Okay.
Yep.
Okay, my bad. Well, thank you. Thank you. Okay. I vote for wait lists. So for what
Yeah,
it's worth.
so I guess my reaction to it would be, we have a clear measure of the heat maps with the infrastructure give us some sense of where kids have access to what they need. A wait list will tell us a capacity issue or a capacity issue or willingness to, I mean, if you have a wait list, it seems to me that that would be the minimal number, right? There could be more kids than are on the wait list because of all the reasons you just mentioned, Herman. But we know that the kids that are actually put themselves on that wait list is a minimum number. And then you've got the readiness scores. I'm not sure that the other two, if they don't have a denominator that's reliable, I'm not sure what they tell us that's actionable.
I'm
Yeah,
going
that was
to,
my concern as well. So yeah, so Colin, I'll just, I'll reach out to the coalition and Head Start and ask that they give me their waiting list data. I will ask for it for the past several years so that we can show what that's looked like because it has been highly variable in Alachua County. So, I mean, there was a time, and if my recollection's correct, I mean, it's within the last 2 years where we didn't have a waiting list.
well, that's fascinating. That would be good to know. The other thing I was going to say, I forgot. Oh, the VPK one, the percentage of kids in VPK. My guess is that if you look by certain zip codes, I mean, it's a totally universal program. If you look by certain zip codes, it might be really, really low, like probably in the 50s. That's a guess. I don't know. And that would be something that would be, to me, that would be, if access is what we're trying to show, that would be a good measure. And I liked what Herman did with the 75.9%, which I think is pretty much around the state average, maybe a little bit low, but if so, not much or pretty close. But I think that's a good measure myself, if access is what we're trying to show.
And so if you could go to slide number 34. So I've reorganized these slides pretty considerably since the last version that you guys looked at last time. So we've made sure that the top end is at 100% on the scale, but then we've broken a level. We've separated level 3 and above, and put it next to level 4 and above for each of the time periods. And if you go to the next slide. This is level 4 and above to show the difference. I think that it makes the difference in performance a lot clearer than the bars that we were looking at before. But want to get other folks' feedback on that and if there's a preferred visualization strategy and whether or not you recommend that I go back and do one or the other for each of the FSA data points.
Personally, I like the line graph. I think it's just visually much clearer.
I will agree. It reminds me too of the National Center on Educational Statistics when they look at dropout rates, and it's very easy to process.
I agree.
I like it as well in the line graph. I think it'd be great to also cluster it geographically. That would help people understand where the needs are and the gaps are with regard to schools and communities and overlaps. That would overlap well with the other heat map and county map you produced. But I'm not pushing for that necessarily for this presentation. I just think it's useful for people going forward.
And Dr. Hausch and Dr. Knopf, do we have access to information that's geographically distributed for this?
Yes.
Dude.
Okay.
Dr. Knopf, if you don't have it, we certainly
Well,
can get that to you. We've worked with that with the education task force.
Yeah, but I think that before we go too quickly with that, I think that we need to think about what geography is being mapped. So, because in Alachua County, where you live doesn't necessarily mean that's where you go to school. And I think that there are plenty of kids that traverse Alachua County daily to get to school. And I think that looking at both where kids are coming from and looking at where they're receiving their services are important conditions that we should be exploring these data. But I also think that it would be important to look at, how much time kids are spending traveling to access services that may or may not be meeting their needs. I mean, so I think that to really do that look without glossing over some things and highlighting patterns that may not be what we think that they are. Because if you're going to locate additional services is what the trust has to do, right? So the trust can't invest in the school to change school behavior. The trust has to identify additional services. We would want to make sure that we're locating those services in places that are relevant to where kids are going to be when they're not in school, not necessarily where kids get school services. You see what I'm saying, Deidre? So, I mean, it's like, yeah, we can get some of that by school district, but I think that we also want to get it by where kids live.
I hear you. I think the case that I was making is to so that people understand that while Lincoln, for example, may be an A school, if you take this percentage of Alachua County I understand this map doesn't, this data set doesn't work with that. We'd have to be talking about 8th graders. By race, you would see that actually the Blacks who live around Lincoln are severely underperforming. So that helps to disaggregate the data around school performance and community performance by race in particular areas. Yeah, that's what I'm suggesting. I hear you with regard to providing services where students live, but often it's, thinking about it from the marginalized perspective, it is not students of color who are traveling. It's actually other students who are traveling to those schools to get those services, which inflates the school grade. So that's why I'm trying to point out the use of that kind of information, but
I think for purposes of the presentation, we need to give relatively soon now. I think that going with this and while explaining that it is a nuanced data set that requires additional drill down as part of the story behind the story, so that it's in that next tier of data that lets us pinpoint places where specific interventions might be more useful, while recognizing that what this says is no matter how you cut it, this is horrible data.
I'm with you.
Right. And so it sounds like the consensus is we prefer the lines. Do we want to do this for both level 3 and above and 4 and above? Or do we want to pick one of the two?
I'd be consistent just from a visualization and getting people used to how we're representing data. I think you want to stay consistent.
Level 3 and above would be my suggestion. Level 4 and above shows us who's excelling. Level 3 and above shows us who's passing.
Is there consensus on 3?
I agree with using 3.
definitely need both. But what I was speaking to was using the line graph version for both as opposed to the bar graph.
Oh, okay, okay.
Sorry, I wasn't clear.
Right. I mean, because I think in our original conversations, we've seen that Florida Kids Count and EKC tends to rely on 4 and above because that's identified as they're proficient readers by grade 3 and are prepared to read to learn. Kids who are 3 and above are passing, but are not necessarily independent readers. But it's the school district and the Department of Education tends to use 3 because they passed the assessment as the level that they tend to broadcast. And if we look at, if you can go back up to slide number 34, which is why I continue to retain that, it allows us to see kind of side by side the difference between 3 and 4 and the proportions that are scoring at that level or above. And the disparity is still there, but it certainly, everybody drops when we go to level 4.
I hear you with what the Annie Casey Foundation and other people are talking about with regard to level 4 and above. But when we're talking about all children are able, successful, have what they need to learn, not having a level 3 is what causes you to be retained at the 3rd grade and doesn't allow you to graduate in high school. It's a gatekeeper. So I would want our community to understand that we're in a crisis with regard to level 3. That's why I'm in favor of streamlining the data so we're focusing on level 3 rather than thinking about a broader holistic view at level 4. I'd love to be there in 5 years, but right now we have a crisis situation and I would want the data to portray that.
Well, could you go back up one more? I just want to look at something real quick, Colin. I can't see it clearly here.
The one I clicked up that was up was the children ready for kindergarten.
Yep, that's what I want. So if we look at this, in 2019, just under 60% of children in Alachua County were ready for kindergarten. If we go back and look at the performance levels at 3 and 4, if we look at level 3, it looks like we see a jump up to 80% of kids are doing well in literacy. But if we look at level 4, that number is pretty close to the same.
Not for Black children. For Black children,
if we
it's only
average it all, you
30%.
got it. I agree. I understand that, but the number before that we were looking at was all kids aggregated together.
Right.
And once you average all those numbers together, we're also, go down to, a little less than 60%, which would be comparable at
Herman,
level 4.
do we not have the kindergarten readiness data by race?
I'm not sure. I can poke around some more to try to find it, but I'm just trying to be efficient with time and.
Right. It just seems to me that if what we're trying to tell is the story, we need to know how early does this gap start. And so right now we know that by 3rd grade, the gap is, as Deidre was saying, at a crisis level, let alone getting to 4. So by 3rd grade, we know that you're not even getting close to 3. Where was the opportunity? Was it kindergarten or was it even further back? And so I think even if we don't have it for this presentation, making a note that having that data by race is critical, because we need to know, when does the gap really begin?
Well, there have
And
been
Yeah, I
how
think-
early
yeah,
are
there have
we
been national
identifying it?
studies, Maggie, that show that, national data that show that it begins at about 9 months.
I know, but our data doesn't
Yep.
hides that now, because we've got this blended
Yep.
rate that doesn't look all that bad, right? So yeah, we know it starts pre-K, pre-childcare for some kids. So we just need to, but I think we need to, that's the message we need to send, is this is why, here's the story for why we're going to have this kind of a priority in this community, because it starts so early.
And as a developmentalist in my area of study, there is an argument for continuity, and I do see how, the school readiness links with this. However, what we also see is with greater development, those successful get more successful, and those who are facing disparities, it gets worse. So I do agree with breaking it down by race, simply because we want to see over time that even though it seems continuous to look at school readiness and level 4 and above, there's some diversion going on from the early years to the later years to the high school years and determining of success. So.
Right. So those are great points. So I'll do my best to see if we can get this broken out by race in ways that are similar to the way the Department of Ed is breaking them down for third grade and above. And if I can find it, we'll include that. Sound good? And then we're going to change all these to lines as opposed to the bars. So what's on the screen right now?
I haven't moved. Do you want to just go to the very next slide, or
Well, I mean, I think that the
same discussion for,
presentation format, yeah, it's going to be the same discussion for all of them until we get down to probably 40.
okay? Hang on just a minute. Sorry.
I just want to be clear, and I'm sure you all, let me just say what I need to say. What the map is showing is that 88% of white children are passing the test in 2018 and 2019, whereas 30% are not passing. If we're thinking about what narrative we're telling and where the alarm is and where we should spend the money, to me, helping people to pass is a much more crucial crisis situation than helping people to excel and have scores that are going to put them in honors and AP classes. I think that that's important, but not even in the realm of importance of just having passing literacy. I just want to be clear that that's, I think, what we're helping the community to understand is where the crucial need is with regard to that data.
So I think, again, it's how you talk about the slide.
Yeah.
I think when we get to that slide, that's the point that needs to be made, is we're not cutting it on the most basic level of achievement, and we need to do much better than that before we talk about this other, while recognizing that just from basic success to greater potential success, the differences continues to be as wide. So even in the kids that are doing really well, there's no little group that's doing equally well, is the message I would send with that one. Even among the 4s, you see these same gaps. And so we're never going to get to 4 unless we deal with 3. But I think you have to say both because they both represent different levels of success for kids.
Yeah.
And different levels, I guess, not even just levels of success, I would say different levels of opportunity. But I hear you.
So
You got to put the fire out first.
Yeah.
So do we want to also share this information by the economic categories that are presented by the Department of Education, or do we want to stick with race-based designation and
I'm happy to share it, by economically disadvantaged. Where the real analysis comes in is to see what that means in terms of intersectionality by race and economically disadvantaged, or are we just talking about the same kids again and with a different label? And if not, that's where there's a point of access for the trust. So I think it's useful, but it's also could be potentially redundant.
I think the intersectionality data, again, is part of the lower level story. Part of the story is there. Does that still have the same pattern? Because the majority of those that are economically disadvantaged also happen to be racially minorities. But yeah, I think the intersectionality, and there was a lot of intersectionality data that was in the report from the Friendship 7, if I'm not mistaken.
Mm-hmm. So is there a recommendation for folks on this, or?
I'd leave it in. Again,
Yes.
with the nuanced statement that it requires more review or more drill down. I think that'll be the challenge for Colin and the team he eventually hires, to start to take a look at what this drill down on all of this data is and what the story is that's behind it, so that that's what ends up shaping a lot of the priority setting for the trust. This gives us a picture of where to point to for that, and it's pretty clear, but I think then the more nuanced stuff is still to come.
Okay, let's go ahead and scroll on to the next section.
You mean the next indicator, Herman, or?
Yeah.
Okay, hang on, I'm sorry. The thing went haywire on me. It's slide 49, and I'm working on getting there. Apologize. Ah. Oh, that's it. We'd like to have. Okay, slide 50.
Okay, so as we go into this section, I just want to call out that there was a lot of feedback in the survey related to the indicators that are listed here, and that many of them are counts of kids, not proportions of either eligible kids or an appropriate population that we would be accounting for, which limits the utility, I think, of a lot of these indicators because we don't know how to put this into context. So same with the discussion that we had with VPK and school readiness and Head Start, is that just sharing the number of kids that are entering out of home care, I'm not sure what to do with that, and I'm not sure that how to share that with the trust, what that number means and the meaningfulness of that. So is this a good number or a bad number? And we need guidance on whether or not we want to, for now, not include those numbers and rely on the indicators that have the asterisks that we also have the Department of Health comparators for, or if there are other ways that you want to represent the state of affairs within the system. But I mean, this is, certainly not my area where I spend a lot of my time focused, and I'm not sure what the best way to communicate this results area through the data that we would want to share with the trust.
So the asterisk data is the DOH data, correct?
Yes.
And so, I mean, it seems to me we have the denominator because we know how many kids live in we know the population of 0 to 18. So would that not be?
Is that what we want to use? Yeah, I mean, is that what we want to use? Yeah.
Would that not be the denominator? The problem is then how do you compare that to other places in the state, which is part of what's going to end up being the question. And maybe a lot of this other is more nuance than we want for the top level, and the 3 that are asterisks tell a good piece of the story: child abuse, sexual violence, foster care. What it misses is some of the subtle things that can have, so you don't have to be in foster care to still be under supervision. And this is Patty's area, but Patty, there's no denominator to just even the kids that are in out of home placement.
So I think where we can look at this too, we can absolutely look at it compared to the number of kids in the county. And then I know I provided the data comparing our county to other counties where there are children's trust boards. I think another important thing for the Children's Trust to track is not just point in time, but trends over time. If we're seeing more children come into out-of-home care, which we expect after COVID, more children in home care, children who are, the rates of verified maltreatment. I think where I have concern about limiting the ages to 5 to 11 is, I mean, it just really, the 0 to 5 range is so important for us as an agency too, for child welfare. And then of course, looking at teens in foster care who are having to leave Alachua County because we don't have enough foster homes who are willing to accept teen placements. I think it speaks so much to the state of our county, but I am incredibly biased. So I would love to hear more feedback, but I think we can find the comparisons, and I would argue almost more importantly, be able to identify trends as they're coming. I will say, I mean, we're better now. Back in 2009, the whole reason we were able to start the resource centers here in Gainesville was Alachua County had some of the highest maltreatment rates in the whole state, and Florida was one of probably the worst states in the nation at the time. So DCF was looking right here in Alachua County to say, what can we do? So we're much better than that in comparison, but I do think it is worth looking at for the trust.
So for those of you guys that are still active researchers, I mean, what's the barrier to going ahead and using the number of children based on the data that's in the DOH Florida charts data is, I mean, that would give you a per capita at least, what % of kids are.
I'm down for it. I think that's what we should do. And I just want to remind us about the conversation we had about, I like the language Colin used around domains. And all of these bullet points under the child welfare system to me seems like it goes under a domain of children in crisis, period. And the same with, you know, what we were talking about earlier with children not at level 3, children who are underperforming with regard to literacy. So helping to frame this data as a particular subpopulation of children who have acute needs might be a way to contextualize it for folks.
I don't know if this is an appropriate time. I did provide some data to Colin and to Herman about some of the numbers that were a little bit more nuanced. And, you know, to Patty's point, there was a big shift in 2009 regarding the definitions of what abuse was. And so the things that would have been considered abuse then are no longer considered verified abuse things. So we're running into a little bit of the political realm about Florida looked so bad as a state that they really went in and refined what those definitions are. So the verified maltreatments is literally the worst of the worst of the worst situations. The children in out-of-home care is only because there was nowhere else and no other way to mitigate the risk. There is this group of children that is in the middle that are, you know, children that are in crisis, families that are in crisis. There could have been an injury. There even could have been an arrest in the situation, but not necessarily meet the criteria of what our state has for what's abuse now. So I really advocate for not just the verified abuse cases, but those that were also not substantiated. Not verified at all or no findings is one thing, but when there are still findings, because those of you who aren't in the child welfare world, there's this middle category, which most of the children are in the child welfare continuum, that still need help, that are still referred for services and often don't get the services that they need because they're not required to. They are offered, but it's not necessarily required. So there's this chunk of kids, and it's anywhere between 8% and 10% of the children in our area, just depending on what time of year. The other thing that Patty said that I think was really critical is there are trends. You know, you see when there are more eyes on children and they're more visible in the community, the abuse reports go up. That's why right now, those of us in the child welfare system are very concerned about what's happening in the lives of children, because the stress has increased, financial stressors have increased, and skills haven't necessarily. So I just want to advocate for the inclusion. If we're going to look at children in crisis, that we don't leave out those kids.
Yeah, I agree. We talked about this earlier at one of the earlier meetings, and I think it's important. And so I think if the best we can do, and maybe we qualify it, is that the denominator is simply based on age data, population age data that's available.
And I don't think that we need I would love to, we can talk about it all too, but we don't need when I filled out the survey yesterday, I didn't think that we needed every one of these data bullets. You know, I don't know that we need to look at children entering out-of-home care and those in out-of-home care. I think just in out-of-home care, children in home care, verified maltreatment. And I agree with Sherry. I think we need to really focus in on that in-between population. I don't think it's enough to say, but I really would caution us to not just limit it to the Florida health charts with the ages 5 to 11. But
yeah, no, not 5 to 11. Yeah. I do think though, Patty, that I would kind of argue for keeping both, because the number of children entering is a point in time. So this year, how many children entered? If this year 10 entered, but we have 20 in, that tells you there are 10 kids in this county that have been in since the previous year that have, that may have. So I think, because we know that the longer you have to spend in, the harder your life is going to be, right? We know that very clearly. So it's almost that maybe entering is a good number, but in out-of-home care may not be as important as how long, do we have data on how long, you know, the kids that are exiting were in care. And that, again, that may not be for this list. But I would say that those two numbers tell a different story.
I do agree with that. I think if we were trying to limit it, you know, but I agree if we can include both, they are really important to look at. I agree.
And I think that data is available. What's really interesting about the child welfare data, different than other kinds of health related data, is it is hard to get your hands on it. And so when it's not just an easy, let's just print this field, you know, it's not particularly popular to be a state that has some of the worst, you know, welfare for children in the United States. So it's pretty hard to drill down to. I just want to make sure that the information that I sent, that Herman and Colin received it.
It's in the minutes.
I will.
It's in the minutes that we approved. Yes, we received it. I sent it to Herman, and
Great,
it's
thank you.
in the minutes.
And every data bullet that I do have in there was straight from the dashboard. So that part is easy to assess. It's either monthly or quarterly, depending on the data that's there. Everything except for the caseworker ratio.
Yeah, and I'm not sure, frankly, that was the one that for me was like low communication.
Yes. Yes. Yeah.
So what is the best way to efficiently get these indicators in a way that is going to speak to what you guys know to be important, but is also going to speak to the trust regarding the extent to which this is a results area that needs to be a focus in Alachua County?
I would say, I think some of them that we have on here now with the Florida health charts could be duplicative if we want to just stick with the DCF dashboard. That way everything is kind of from one source. And again, Sherry, I haven't looked at the minutes, so I don't have, but I'm sure yours is sourced from FISFIN or.
It's from the dashboard.
From the dashboard.
And so, but I wanted to use data that was reflective of the same time period of the data that you pulled. But in order to get to it, you had to drill down to adding the verified as well as the non-substantiated cases together. And so I provided a chart that had all of that information in it, but I tried to use it on the same time frame that you provided so that it wouldn't look wonky or would still be relevant.
Yeah.
So I think what Herman's asking about, I think these are really important conversations. I think what we're trying to figure out is what recommendations you all would have. Is this an indicator or a set of indicators where it's better to track these data longitudinally to look for peaks and valleys versus trying to create a proportion? So, right? So, for example, children entering out of home care, is it better to monitor that on the dashboard over time? And so we don't care about what percentage of the population, we just care about whether there are ongoing fluctuations in that particular target population. Or is it important to communicate that of all children living in Alachua County, 15% of them this year entered out of the home care? Do you see the difference? And so that's what we're trying to struggle with in terms of how would you, what would speak to the public about why we would need to make investments in this, or is it both? But
I think you need both. I think you need to know the number, because in some cases when you see that number, when you see 1,500 kids in some, that's a startling number to a lot of people, but the percentage gives you some context about prevalence. I would agree with Patty that I would stick to the DCF dashboard data instead of the DOH data on this one, just because it's closer to the source and makes it consistent. So, and it would take a few of these just off.
And does that dashboard present proportions or
No,
percentages?
it's just raw numbers, I think.
You have to do the proportions yourself. And that's part of what I did when I provided the data a couple of weeks ago, is I went through, because for our purposes at the Child Advocacy Center, the percentage is really important so we can track, has there been an increase? Has there been a decrease? What are the factors involved? It doesn't do that work for you, but I will say some of the incredible value of that data is it's kept up very regularly. So we have data already for 2020.
Yeah.
And I think that's really valuable that we have that kind of ongoing data to be able to access that you can't in some other arenas.
Yeah,
So I
and you
think
and
if
Patty, I
Sherry's
mean,
done the math,
and you and
go with
Patty and
it.
Maggie, I think, know that data inside out. And I guess what Herman's asking for, what I think we're asking to think about is, what's a fair denominator then if we're going to be presenting this as percentages?
What
Is
did
it-
you use, Sherry?
I used all children, the population of children of that time period, which, you know, is in and of itself a little bit of a difficult number to get
It
down
is.
to.
Yeah. it is.
But I use a percentage range because of that problem. But I still think it's alarming to people to say, okay, well, it's 4,300 children were involved in child abuse investigations last year, and that's about 10% of our child population, and that's a pretty mind-blowing thing for a lot of people
Right.
to acknowledge.
Exactly, Sherry. Yep.
So I guess
And that's-
Herman, use Sherry's data would be, I think, the direction.
Well, fortunately, Sherry's not on the committee. So what I would like to do is schedule a time with me and Sherry to just do a 30, 45-minute meeting to go through your data and prepare it to include in the PowerPoint. That I can, I'll share a draft as soon as Sherry and I have something done on that, and then we'll actually really go over it with you guys when I do the practice session, if that's fair, to keep us kind of moving forward.
That'd be great.
I think that's good.
And by the way, the Sherry's data is in your agenda packet. It's third from the last group of stuff that was included. So it's in there.
And thank you for allowing us to help with that part of the data that you're taking a look at. I'm hoping that it's helpful.
Always.
It will be shared. All right, so is there anything else that we want to talk about related to nurturing and supportive caregivers and relationships? Okay. Well, let's go back up to the caseworker ratios. So what's our recommendation to the board about those numbers?
I don't think it tells a compelling story. I think it's an issue for all child welfare agencies, but I'm not sure what it communicates to the community.
I also don't know what we can really do to impact it.
Yeah, exactly.
But yeah.
It's really a policy thing that you advocate for statewide, which the child welfare groups do every year.
Right.
Okay, so it seems that the recommendation here is that we'll just drop that slide out. Next one, 62. We don't have anything. We've got stuff that we want. And I think that's not problematic. And I think that with this, the board could say, well, if we don't have any indicators to measure this, then we're not going to care about it. And that's that. I think that we can describe the importance of this results area, identify, if we go to the next slide, some potential sources of those data that the trust could choose to help facilitate. We need to talk about how we would get access to these, or maybe we just say these are some data that we would like, And one of the recommendations is the board identifies someone that will go and get data on this, to talk to people in the community.
I would like to add a point where it states youth's ability maybe to have agency, and also teens and extracurricular and enriching activities. There is information, but it's only youth self-report in the middle and high school Florida Youth Substance Abuse Survey that is specific to Alachua County. So it's like single items, but it does, and I mentioned that in the Survey Monkey response.
Mm-hmm.
Do the schools track the volunteer stuff that some of the kids at least report? Those volunteer, I mean, do we have any data on their volunteering activities? I know some kids do it for Bright Futures, but do we have any of that kind of data? And they do an award
it depends on who. Yeah, it depends on who we is, right? I mean, sure, it has to be captured by someone, right? To grant the certificates and to count it toward, you know, either their high school graduation requirements and Bright Future requirements. I'm not sure where, but I mean, I think we can get it. I mean, that could be a request to the School Board of Alachua County.
It might be just worth asking. Again, you're not going to have it for this presentation. I think what we need to say for this presentation is that we think this is a really important area for children's health and well-being overall. And we're sort of surprised at how little data exists to capture it. But I think it's an important dimension. And I think, yeah, the risk is that they'll say, well, then we can't do anything about it right now. And it may not be the crisis we want to address first anyway, but I think it's important to keep it on the radar.
I agree.
Mm-hmm. Okay, I don't know how many more slides we have in this thing, Colin.
We're on the safe communities indicators, and there's not very many more, probably.
Right.
Yeah. 10.
Well, I think that, you know, and we could go kind of, so, so we have youth arrested, index crimes, violent crime rate, and children in adequate housing. I think that from the survey, we have some other indicators that we want to include from the Department of Health related to, I think it's sexual abuse. You know, never mind, that was up above in a different indicator. I'm getting confused now. Also in the feedback from the survey, there seemed to be, in the comments, there's a consensus that the SBI, with all of the subdomains integrated together, seems to be a useful way to look at community vulnerability, but breaking it out into socioeconomic or the other sub-indice calculations was more relevant to story behind the story, and wanted to bring that conversation up with the group.
Well, that was certainly some of the feedback I gave on the survey.
Yes,
that
me too.
So.
Okay, Colin, could you pull up the Survey Monkey presentation that I emailed you?
Give me just a minute. Okay. Give me just a second. Is anybody seeing it on the screen?
Yes.
Okay.
So first I want to thank all 10 of you who logged in and completed the survey with a short turnaround. I've tried to pull the results together. And so Colin, you can see that there's slides that I've hidden, and those are the same. I tried to reorganize the way that SurveyMonkey presents the data to help provide as much clarity as possible as we're looking across indicators. So I think we're looking at essentially question 1.
Yep.
And so as we're looking at this, yellow was our indicators that were rated high. Blue were indicators that were rated medium, and green are your folks that rated the indicators as low. I've tried to organize these so that we have the communication power, proxy power, and data power on the same slide, so that we can look across all 3 of those indicators to identify the indicators that seem to hold the most power across versus funds that seem to be low power. So what we're really looking for, and you guys are gonna have to tell me what medium means, right? So as we're looking at these, high is pretty easy. So for the indicators that we have, 90% or more, or 9 or more of our respondents indicated it was high power, I think that's pretty clear that that's a high power indicator. So insured children, as an example, comes across uniformly as high. There are others that are a little more controversial, such as seriously emotionally disturbed, where we have, 6 people said that it was high, 3 people said that it was medium, and 3 people said that it was low. And then as we go over to the data power, it's even more people rated as low because it's difficult to get at. As we're thinking through and identifying the most important or most powerful indicators that we have, as you guys are looking at these, are there indicators that don't seem to be particularly powerful?
Sorry, is there any way to make this bigger?
Yep.
Thank you.
And if you use view options in Zoom, you can also change it so you can see it larger and then move the screen around.
Okay, thank you. That's super helpful.
Thank you. That was very helpful.
Yeah. Wish I had known that a couple months ago now.
So I can kind of say that for me, the way I looked at this, the stuff that I tended to put medium, I thought really might be backdrop things more than wowie, yes, the community would get this and it would mean a lot to them. And I was definitely one of the people that said for the social emotional disturbed, seriously emotionally disturbed, that was low. It's also a term that's really not even used in the school system anymore. It got eliminated a long time ago. So I'm not sure, it's social emotional development. And I was actually trying to root around to see if I could see anything that was connected to that, and you guys know the survey data much more, whether either of the youth surveys could get at any of the social emotional learning or development items. But I thought SED, it used to be, frankly, a bin into which conduct disorder, ADHD, and oppositional defiant children got thrown because they acted out and they were disruptive in school, and that's how they got into special classes. I mean, truly, that's what it served. So I'm not sure what it communicates. So to me, anything that has low data power, that there's consensus that there's low data power and there's a number of them, we ought to really seriously question whether we want to use them as a first line measure.
Right, and also looking across the oral health indicators, there are a number of those that don't seem to, based on the perspective of our committee members, don't seem to hold a lot of power. I believe correct me if I'm misremembering our communication with Scott, but I believe he mentioned that untreated cavities was, of the one that you should choose if you could only choose one.
Yeah, I think so.
Yeah, it has all sorts of nasty potential downstream health consequences beyond just oral health and losing your teeth and all that good stuff.
Right. I mean, you're a young kid, third grader, being able to eat and talk and play without his mouth hurting is pretty important to development and learning. So it looks like some of these oral health indicators we can probably remove. Aside from untreated cavities, I think we would retain. Are there others? I mean, it sounds like Maggie was recommending the estimated seriously emotionally disturbed. There's another category that.
Yeah, I would drop it.
Hey, Herman, this is Maureen. I also rated that as a term that I just don't think, I think there are a lot of children that are missed. It's not a particularly sensitive that measurement system.
Mm-hmm. It used to actually be a formal classification within the school system, SED kids, and they got rid of it. So I don't know what the data source for it is now.
And then breastfeeding. I mean, there's a lot of discussion about that. It's important in our calls. But then when we got information from you guys, it doesn't seem to resonate as having much proxy or communication power.
Yeah. I just don't think that a lot, I mean, I agree. I think there's so much benefit to it, but I don't think that for the community at large, whether you're a breastfeeding mom or not, communicates. That was my response to it. Is like, yeah, I think it's hugely important, but I don't know what it communicates to the community at large.
I agree.
And then I think that we've got some mixed results on the team moms. Haha. But I mean, so it looks like most folks are either think it's good or okay in terms of communication power. Proxy power, there are few people think that there's a lot of power there. And then the data power is fair to middling is what it kind of looks like to me.
Yeah, I thought this one was somewhat redundant with moms who didn't graduate without a high school degree. And I wasn't sure which one communicated better. I mean, teen pregnancies are high-risk pregnancies. Older women giving birth and younger women giving, those are high-risk pregnancies with all sorts of potentially negative outcomes. So I think it's an important measure. I was one that rated it high. both communication and proxy and data. That was one of my high across the board, and I tried to limit myself to 4 of those for each group.
Yeah, and I didn't rate it highly, I don't think, and the reason for that is because I thought that we were trying to reduce to 3 or 4, which was very difficult for me as well, Maggie. But I feel as though if we look at the story behind healthy birth weight, we would not only see teen mothers, but we would see prenatal care, and we would probably see other indicators.
I think that's an excellent point, Pat. I think in that context, I would say then to reduce the number, don't use it.
And just a suggestion on how to make, I'm not sure how much effort would be involved, but if you gave the highs a 3, the mediums a 2, and the lows a 1, and you add it up across the 3, I would say if you're not a 7, if you don't at least come out to a 7, you probably don't need to be on the list.
Yeah. Yeah, and you can do the weighted, you can do SurveyMonkey and look at the weighted average.
I guess I wonder, is our goal to say that we're eliminating these because we don't?
No.
Is our goal to say
No.
to the trust, these are ones that the technical advisory board felt like were the best, had the best communication power, proxy power, and data power? If it's the latter, I'm okay with that. If it's the former, I'm not so sure.
So there is no bad data. So this is what my goal would be. So there's no bad data. It just means that if you want to give a snapshot on about a page of how is our community doing for children, is that what you'd put on there? You know, so how is Alachua County doing for kids? Well, we don't have that many teens giving birth. I don't know if that really, you know.
Yeah, I like Pat's point of view on that. I think if we use it as part of the data behind the indicator,
right.
And so I don't want to lose any of these. That was not my thought about it at all. I approached this as what goes up on the dashboard, and then what's behind it that we can measure and that we can use to say, well, where do we intervene? If we look and all of these low birth weight kids, a good proportion of them are teen moms. Well, then that gives us that's a program we may want to fund to help moms delay giving birth. The other one that I will tell you, Dr. Hart would be all over us about is the interval between birth measure.
So I think
like
I
real
think what you
predictive.
said is right.
So
we want to keep all of the data.
Right.
Because if we want to know the right answers on how to address the problem, we need all of it. But it's just what can you put on a page that says how well is our community doing, or 2 pages or whatever.
So I think that clarification will be important is when we present this to the trust.
Yep.
Well, I hit something here by mistake. Okay.
Otherwise,
well, you know,
I be like their favorite indicator isn't on there, right? So I mean, I just think it's important to keep saying we're not throwing any of these away. We just think these have the most communication, proxy, and data power, which I like that layout very, very much. But I wanted to just clarify that that's what we were trying to accomplish with the survey.
Well, and I think that we could use this to, and you know, here I am coming up with new ideas that are going to require more work.
That's why we love you, Herman.
So, you know, Maggie, you know, this idea of a dashboard really resonated with me. And so I'm thinking, you know, in the presentation that we have, what if I were to kind of rethink that format a little bit and retain everything that we have, right? So that there's no discussion of, unless, other than the ones that we've already decided that we're going to drop before we got to this part of the discussion. But to actually create for each of the results area, that dashboard page that shows the indicators that hold the most power across communication, proxy, and data to the 1 to 2 page idea. And then the other data that don't hold as much communication, processing, and data power in the slides that follow that kind of dashboard overview of the results area. Does this sound too crazy?
Well, I know. I think it's a great idea. And as I think about formats and PowerPoint and smart art kinds of ways of demonstrating it, one thing might be to have on a box with, here are the dashboard indicators and here's the story indicators. Here's the behind the story indicators. So you have the 3 or 4 things that are over here, and whatever didn't make that list from here goes in that side box. As the drivers, and I'm thinking back, Colin, to the slide that you put in from Trying Hard Isn't Good Enough, that has the result, the indicator, and then the story section.
Mm-hmm.
Because that's what we're, I think, talking about, is that a lot of those other things that we don't want to lose belong there, but as part of understanding the nuance better and understanding what programs we might want to put in place, which will help to answer Ken's question at the last, or Lee, I think it was Lee actually, who was asking about, well, how do we know what the priorities ought to be? Well, when you start to look at some of this sub data, you kind of start to see what the priorities might be. Herman, does that help or hurt?
That helps.
I'm even happy to send you a one of the smart art graphics that I like for that kind of thing.
I would love to receive that.
Okay.
I'm going to do a new share. Fortunately, this work is already done by the results-based accountability company, and we can buy their dashboard and just fill in the data, and it'll do all the graphs and all that. And what you're talking about is, Maggie, is sub-indicators. So your indicator might be birth weight, your sub-indicator might be teen moms and some of these other things, and that would take some work, but this is already done. I already talked with Maya about this, doing this way back on and using this dashboard. And then she told me how much she thought it was going to cost. And I said, ooh, let's see how this goes. But anyways, this is something, the work's already done. So creating a dashboard, you know, I don't know if it's better for Herman to do it from scratch or to just upload all in this, if we could do it in time for the next trust meeting. But anyways, the work's already done. There's already software that exists to do this.
Maggie, you're muted.
You're muted. I'm going to unmute.
Sorry. That's terrific, and I think you've got the money to spend on that. But what I was talking about was a higher level view of just what, you know, here's the main indicators and here's what we are considering the sub indicators.
This would do that. This does that. Trust me, it does it. Yeah.
Then, but Herman needs this like when? So is it plug and play?
It's plug and play for the most part.
Cool. Yeah, there you go.
Herman doesn't have to use it. We can talk about it after, but it's plug and play.
Well, even if we don't use it for the presentation, we probably should talk about the fact that it exists at the end of the presentation, right? Because
right. Yep.
Well, Colin, how quickly could you get your subscription set up?
I have a credit card, so as long as it takes to type in the number, I guess.
Cool.
All right. Well, why don't you go ahead and get that subscription set up, and then me, you, and Maya can identify a time to meet on like maybe Tuesday next week and explore whether or not it would be feasible for us to put what we have into that format. And if not, then we'll make revisions to the PowerPoint that we share.
Yeah, I'll still send you the smart art graphic that I like for that kind of thing, and then you, depending on what's most feasible for you.
Yeah. And so, I mean, I want to go, I mean, if we can get it done, I'd like to load it into the Clear Impact software, because then that's an easier thing to hand off to Colin to continue to deal with moving forward. But I mean, the only constraint is how the system is organized and how easy it would be for us to actually build it, based on the feedback that we've gotten from you guys thus far.
Yeah, and I think Colin's notion of if it doesn't get a 7 or higher, it probably isn't high level. If there wasn't enough consensus in our group, given the diversity of the group, to reach at least a minimal score, it gets demoted. And then the real question is, if we had things that were really low, do we include them at all? Are there any of those that we need to just think about dropping?
I like that too, but I just want to consider giving a little nod to, you know, I'm not an expert in any of that first section that we just answered, so I wouldn't want, you know, my answers to be a tipping point one way or the other. So I'm glad
err on the side of inclusion.
Yeah, I don't want to, my opinion, my uninformed opinion, to screw this up for anybody.
Well, but
no,
on the
actually, Patty,
communication
I
side,
think that, yeah.
on the communication side, actually having someone who's a non-expert opine as to, does this speak to me?
I guess that's true too. Yeah, but I just wanted to qualify some of that as I was answering, and I'm like, this just isn't my field, but you're trying to focus in on the communication part.
I think for these, Patty, it's actually really good to have folks that are out of the area responding to the communication and proxy power.
Okay.
Because it serves as a nice gut check for other folks. And Colin, the next slide that might be important to discuss is slide number 4. I think that we've already talked about these comments for the first section relating to Dr. Tomar's departure from UF and whether or not those data will be available in the future. I think that we can send an email to the dental school to see if anyone there is going to continue that work. But I think that for purposes for right now, I think that we just share that as a potential limitation for data quality moving forward.
Jeff Feller is not on the call today, is he? AHEC may have that data too, because I know they used to, whenever I used to be on the Rural Health Partnership Board, we talked a whole lot about oral health and dental health. And the folks at AHEC may have some information on that if that they can track or are tracking. I don't know.
Okay.
But that's a good
and
question.
Then we can, yeah. And then if you skip ahead to the next slide that has all 3. And there's a lot of yellow in question 2.
Mm-hmm. So I think we keep them.
Yeah.
I mean, the only one that
think
doesn't, it looks to be disciplinary actions by type.
Which I did not include that in the PowerPoint presentation because I'm not sure what that communicates to people broken down by type. The way that it's presented in the Department of Ed. I think that will be when we get to a point where we're looking at both school-based and geographic disciplinary actions that are taken. I think that will become even more important to see if we see school-based trends in how we respond to children's behavior.
And
but
that
also
may belong more in safe community, in safety than here. Although if you're out of school, you get suspended, you certainly can't learn.
But I mean, I also think that we're going to see referral rates for services that would be provided outside of a typical classroom.
Yeah.
I looked at that indicator as well as, again, related to the percentage of students who are absent for 21 or more days, because it's a possible reason for absence is suspension or expulsion, right?
Yeah, we actually, Dr. Neff, I don't know if you remember in the PowerPoint, because in the Department of Health profile, they had out of school suspensions. So we could track that long term. So that we included in the PowerPoint, I think, in place of disciplinary actions.
That makes a lot more sense to me.
And then there's a lot more reasons for being absent besides that, but that's one reason for
Right.
being absent
Right.
more than 21 days.
Right, and it may be to avoid, I mean, kids are absent, especially in high school, because they don't want to be there because it's an environment that's not meeting their needs, or these kids are getting a lot of disciplinary actions on the days that they are there. So
Or they're being bullied or whatever, I mean, it's.
yeah. There's a lot going on there. There were some comments. If you could go to the next slide, Colin. And we talked about this a little bit already, and I just went ahead and created a little visual so folks can kind of see kind of the potential mismatch and overlap between Head Start, VPK, and the school readiness program.
So that was me, and this
visual,
really corrects me. Never mind.
No. I mean, I think that, just to help understand also the sizes of the circles are also represent kind of eligibility on the left versus actual take up on the right, and that, the kids in Florida that are eligible for SR related to Head Start and VPK is potentially much larger than the number of kids that are actually getting the services in comparison to these two groups, because the age band is so much wider for school readiness compared to VPK, which is only 4-year-olds. Head Start is more, in early Head Start covers a larger age band, but they're also on the actual enrollment, their capacity limit is considerably smaller. So in Alachua County, Head Start has funding to support 640 kids. That's it. Their grant doesn't change based on community need from year to year unless they're coming out of a rebid situation.
Well, the other complexity, Herman, is that VPK is a universal program, and both Head Start and the school readiness program are needs-based. So I think that's another complexity. It is true that kids can be in multiple ones, which is why you have the overlapping, right, intersections.
Mm-hmm.
And then, of course, there are early care education providers or early learning programs that aren't part of any of these 3 programs, but are providing Millhop or Montessori, just as an example, they may be a VPK provider, I don't know. But
Well, here's where I'm going to join Patty and say I don't want my ignorance to sway the decision to keep any of those then, because I had not been aware of that nuance. So I'm.
Yeah, and also, the comment about waitlist information, I think we've addressed that, is important. And then there were a couple of comments about high school graduation, and it may be too much of a lagging indicator. And want to get folks kind of thinking about that. That's like kind of the end, right? That's, those kids are, that might be a result of a community that supports kids well. But you're not going to intervene based on that. You're not going to intervene with that group of kids. Right? That lets you know how well you did. That allows you to reflect on the quality of the system over the past, 18 years for kids. And it takes you 18 years of providing services to get a change in that number. But if the trust is around for 20 years, then, what are everybody's thoughts on that one?
to me, it's an important endpoint indicator, as you're pointing out, Herman, but I think people will have to understand the need to be patient on how some of these indicators may move more rapidly and others may take a longer time to be responsive to community-based interventions.
I also think it asks the question, is there a point sooner than 18 years at which you can intervene in such a way as to take a child who might have dropped out or not graduated and help them graduate? What's the difference between hanging in and not hanging in? And is there a tipping point in that where you can intervene?
Yeah. All right, so I think keep it. I mean, it came across as pretty powerful across everybody, but I just wanted to acknowledge that there were some comments related to that one. How much tolerance do you guys have to continue on for a little while, or do you want me to send this PowerPoint and you guys?
No,
I mean, we're over 2 hours.
Yeah, let's just slog on. We can just press on.
All right, if you can move ahead, Colin. And, you know, here, I think most of these, the concerns raised relative to these indicators were the related to communication and proxy power are related to the fact that these are numbers, just accounts of things, and then have limited other information necessary to understand the value of what we're looking at. So just showing that we had 640 kids in out-of-home services isn't going to communicate something meaningful about the results area. Looking, you know, I think that the work that Sherry and I are going to do will, I think, provide a lot more meaning to these indicators.
Yep, I agree. I think we leave them until you guys finish that work because I think it'll.
Yeah, and I think you all think about what makes the most sense for being on the dashboard would be my recommendation.
Okay. I do still think that over time we can show, you know, hopefully what we could show is the children's trust is able to help impact, you know, a decline too in those numbers, again, over time and a trend.
Okay, can you show, let me see if there are any other comments on this one. That would be the next slide, Colin. I think we've addressed both of these already in our conversation today, so we can move on. And, you know, as I think I already talked about this, and this is reflected in the next slide in the comments as well, is the social vulnerability sub-indices didn't seem to hold a lot of power from folks. The overall social vulnerability index and then the other crime rates seem to be more powerful.
Agree.
And then Colin, if you could go to the next slide and see if there were some other questions that comments that we had that we needed to describe. And some other comments for our consideration. Thoughts?
I think those are good.
Okay, we'll see what we can do. And so these are all items that we have placed on the data development agenda. And this one, as you guys are rating data power, you should have been rating this more related to either measurability or feasibility and getting access to these data. And so I think that should be pretty influential weight as we're looking at these data.
Yeah, I agree.
And so I think that we have a number that folks think, yeah, this would be important, but like, for example, children able to regulate emotions, we're not so sure how we're going to get access to that data to report it on a community-wide level.
Right. Unless it's part of one of the youth surveys. And again, I haven't looked at the items on those surveys in a long time, a really long time. And so I'm not sure whether they have anything on there. Some of the folks that are more familiar with the content might be able to speak to that. And if they are, if it does have at least some sense that you can glean about that, then I think it's really, really important. Because in fact, what we know is that kids who come in without a lot of that early social learning are going to act out in school are going to be the ones that get in trouble. And it is all about the ability to regulate behavior and emotion. And that has a huge connection to cognitive development as well. So if we can get at it from anything that's already broadly used, I think it would be important. Otherwise, we have to figure out a way to measure it. And I'm not quite sure what that would be on a universal basis.
Maggie, just to add, we have a doctoral student in our department doing some research on depression and emotional self-regulation, and she was able to find an indicator, but I don't think it was very good, of emotional regulation.
Yeah,
I can email it to you, but it wasn't great.
Yeah. Well, and then you're still adding one more layer of surveying or assessment to a school system that's already overburdened. And so who's
Right.
going to do that, and how do you, that's why I'm saying, I think just in a feasibility sense, unless we go back to having conduct scores on, you know, I don't know. I don't know.
And I mean, another troubling one on the data power was pre-K children who are able to self-soothe and use words appropriately to communicate.
That's part of emotional that's part of self-regulation, right? All of those two things are part and parcel of the same thing.
So what struck me as I was thinking about these further too is that perhaps some of these might be candidates for performance measures that could be built into, not all of them, but some of them could be built into some of the projects, which if they performed well at a performance level would then help us maybe link them back to some of the higher level indicators, either on the dashboard, or they could rise to the level of something that we could eventually look at the feasibility of and acceptability of using them at a community, you know, at a community-wide level.
And it is part of what's being done in the SED contract, at the pre-K, at the
right.
preschools, right? Is
right.
teaching the teachers how to develop it, teaching the parents how to develop it, and intervening with the kids that are showing problems.
Right. I would imagine some of the youth programs would be addressing the physical activity one, right? And so.
Yeah.
I
Can
feel
we
that,
move to the comments on?
So seeing common measures would, I think, be really helpful. And I think that's the one thing that they talk about in that framework as well.
so what you just said, Dr. Schneider, I feel that way about just about every measure on the kids connecting with the community. I think those are all more program attributes that you can measure on how well programs are doing on those things. It's going to be very difficult to say that about all kids, though.
But what's the collective impact then, Colin? How do we measure the collective impact of those?
I don't, you know, I view kids connect, in my opinion, just being me and an expert in nothing, is that if connecting kids to the community and contributing is a mechanism that will improve a lot of these other population level measures. That's my guess. The expert on that would be someone like Dr. Fogarty and what she does. But, you know, kids with positive connections, that's the argument of these programs. And that's what we used to measure, is that if we can connect kids better to adults, relationships, and communities, and doing activities, then you will see their grades improve, graduation improve, communities will be safer. You know, that's kind of the overarching.
So is it a strategy rather than a result then?
I think so.
So
that's my opinion, but like I said, someone like Dr. Fogarty,
because we've got it as a result.
Yeah, I don't agree with that. So, I mean, and it had no population measures, which I don't think it's something you're not interested in, but I think it's something that you wouldn't be interested in for, yes, a result. It might be something where a strategy were to develop programs where kids are connected to the community. In order to improve everything. I mean, you could see if kids are connected and contributing, you could see a lot of indicators move in the right direction.
Well, Colin, I appreciate that vote of confidence. But as far as like large scale data, indicating that we only have that more in non-formal educational systems like 4-H that I work in. But there is a bigger picture in the community. The best we have is the Florida Youth Substance Abuse Survey again, or possibly the Youth Risk Behavior Survey, but it does ask questions about students' involvement in school, after school activities, and special projects done with teachers for, I guess, middle and high schoolers.
And can we get access to question-specific data?
Absolutely, absolutely. In fact, the only concern I have is what's collected in 2020, so maybe 2018, because I think that's when the individual counties are done with FISAS. But I have that data, actually have access to it because I'm working on a team. We're doing some research and publications in that area, so.
So maybe that's the best we can do, but I think the higher order question is, do we really see this as a result or as a strategy?
True,
which I hadn't thought about
exactly.
until just now.
So if a kid is not in an after-school program, if you show me data that 40% of kids or 60 or 80 aren't in after-school programs, I would say, so what, right?
Right.
And I think the so what is, well, there's a lot of other things we care about for kids, where an after-school program is one of the best way to improve on those things. And so long as the programs have all of these specific attributes, then the chances are pretty good that if they're connected to those programs, like a 4-H or something, that you'll see a lot of other things in the community improve. So I would not.
Right. It is a predictor, much more predictor than an outcome. And even Florida Youth Substance Abuse Survey, when they ask the questions about neighborhood violence and handguns and stuff, they're using that also as a predictor because they're basically talking about risk factors, protective factors that predict youth outcomes. So this is a little challenging, but of course the data, are collected year to year, but not longitudinally. We don't trace the same kids over time. So it's a little different dynamic there. That's an excellent point. Predictor or outcome.
Herman, are you ready for the next slide?
Sure. Which?
Well, there were some comments on number 5. I think we addressed those. Let's see.
That first one was mine.
Yeah.
And yeah, that access to mental health services one is another really troubling one. Sort of like the, being insured doesn't tell you whether you're going to access. Just to give you a quick example of what's happened. So after Marjorie Stoneman Douglas, the state funded additional children's wraparound teams and mobile response teams. When I was at Meridian, from June 30 to July 1, we received funding that would have required us to add about 100 staff, 100 counseling staff. They're not in the pipeline. So the challenge is not just, well, can you screen these kids and identify all these at-risk kids? Heck yes. Then who's going to pay for whatever they need? And even if you answer those two pieces, are there the professionals out there or in the pipeline to be hired to fulfill the need? So that whole question of access to mental health is really 3 questions in one. And I can tell you, by the way, that they're still trying to hire all 100. Because that's in addition to the regular turnover and replacement of staff that leave for all sorts of other reasons over the course of the year. So it's not an easy problem. And it's not an easy thing to measure. I don't know which of those we would be talking about, right? Have we identified the kids? Are there enough staff available? And is there anybody to pay for it?
Well, I think in that way, Maggie, it's similar to, as we're thinking about access to quality childcare, right? Is that it's not just.
Right.
Okay. And I mean, it seems that there were a lot of reasons why we would want to explore more consistent use for the Florida Tobacco Survey and the Florida Substance Abuse Surveys.
Mm-hmm. Yep.
And I'm thinking that the reason why the proxy power is medium on this one is in the data power is low on the Florida Substance Abuse Survey is because we don't currently have a system to collect this consistently in Alachua County. Is that an accurate?
I think
would
it may
say,
also reflect that people don't know what all is in it.
right. And the surveys, they are available on the Department of Health website, or Florida Department of Health website. But I think we don't know, for example, how the data collection were affected because the beginning of the school year, right during COVID pandemic, there were some issues there. But I think, so you can kind of know what's on the survey, but as far as I think what was mentioned consistently by this group was the issue of, we can maybe get charter schools and public schools have access, but we're not, looking at private schools and other alternatives. So that's the challenge. This data is semi-representative of Alachua County, but in another way, there are groups of students and young people missing from the equation.
Any other thoughts? I don't know how you address that because, there are reasons why it would be difficult for private schools because there are private schools that don't want to, whose parents don't want their kids to complete these surveys, right?
Exactly.
Particularly related to the youth risk behavior survey, right? There are questions that parents don't want their kids to be thinking about.
Exactly. And now the Florida Youth Substance Abuse Survey is including adverse childhood experiences for high schoolers to report on. And those are some pretty tough questions.
Mm-hmm. All right, Colin, could you show me the comment for this one?
Yeah, just what we were talking about.
Yeah. And I think that because these are surveys, so these are collections of questions, and so that I think that putting them in one area is going to be problematic no matter what we do, because there were, Katie, you were identifying indicators from YRBS throughout, right? Through all our result areas. So, I think that, maybe it would be appropriate, to add just kind of a general recommendation that, here's a survey or a tool that may help us answer questions in multiple result areas for youth in Alachua County and YRBS.
If you'd like me to send them, I'm glad to.
Yeah, I think that would be good.
Yeah, they're in PDF format. The only challenge is that, they do not allow editing or even copying and pasting. So I have to kind of look at it and retype the item specifically when I was putting comments in.
Fun.
Yeah.
All right, next slide, please.
What was the children moving from what?
Let me pull up the PDF.
That was children moving from out of home care to in-home care, I think, or the other way around.
Or
from in-home to out-of-home.
In-home to out-of-home.
Yep.
Yeah, and that's a failure of the system. So it's an important, and the incarcerated parents. And then the percent of children, the last one is the percent of children referred for mental health. Again, you're going to have public school data on that. You're at least on the number of children. because they are now required to report that as part of the legislation under Marjorie Stoneman Douglas. But it only applies to public, and therefore public and charter, I would imagine. But that should be available, I would hope, at some point from the DOE website. And again, it may only, and I'd have to go back and look at the way the statutory language read. I know they're keeping track of kids that are being served within the school, but I know that there is actual statutory language around how many are they referring to other providers, and then what the response time is to actually have the child be seen and screened.
Can you go to the next comment, please?
That's helpful.
Mm-hmm.
So it sounds like if we could, that may be one of those that if we could figure out in the community how to sell that, or even expand who's willing to use it, it might provide some really useful data. And it might be a project that the trust can undertake to bring together the players that would have some ability to make that happen.
I like the fact that there are some positive indicators.
Mm-hmm.
Mm-hmm. I mean, it seems that, you know, FYSAS and youth behavioral surveys are both important.
Yep.
Okay, question 8.
What was the children referred for item in this one? Is it the same?
Children referred for problems interacting with their peers.
Yeah, I'm not even sure that that's a category that anybody discreetly measures, even in school disciplinary referrals or.
And I don't know either. I'm not sure what categories the teachers are using when they're making referrals.
And each school district has its own plan. I have no idea how we would even, right? I think everybody said low on that, it looks like. Oh, no, I was covering it up.
And then it was also, we seem very low for the last 3, which are, we already talked about children referred for problems interacting with peers, but then there's youth help to develop participation roles and have opportunities for leadership roles in the community. And youth have agency and the ability to build new skills.
Yeah, I don't know how you measure those.
So again, those are all, I can tell you, those are all, from my experience, specific program attributes.
Mm-hmm.
You can actually look at a program and observe it and say, are the kids learning new skills or not? That's to me, that's how a lot of these are used.
So, but that brings us back, Colin, to is this whole area of connected with and contributing to the community a result or a strategy? And it may be that it's just something we think is so important we put up there as a priority because we think it will help with many of the others. But I think that that's an area where we may just leave that to the trust to say, how do you want to treat this? We don't have any data. We think it's an important strategy, but we don't have any data about it. We just know that kids that are do better than kids that aren't.
Mm-hmm.
All right, well, let's go to the next one.
You want to skip past the comment and just go to the next one, or?
Yeah.
Okay.
Yeah, let's just go to 9.
What was the last one? The percent of children with adequate.
I'm scrolling down just a sec.
That one's
Housing.
Mhm.
Oops, sorry. Hang on, sorry. Okay.
Yeah, so what was that what's the rest of the last item? The percent of children with adequate what?
Housing.
Oh, well, no wonder we all thought that was important.
Yeah.
Children in the adult system. Yeah, I think that Terry stops, even Professor Quinn had said that she thought a lot of that data was often inaccurate. So I gave that a low just because of that. And I didn't know enough to challenge what she said. I'm assuming she's correct on that.
Yep. And the Terry stops are just, what? It's not a probable cause stop. It's a reasonable suspicion stop, right? So
yeah.
I don't like you here right now.
Right.
How you doing?
Yeah. The next one, the youth arrested referred to diversion. Here's an interesting wrinkle to that. So in the last couple of years, there's been a real push for civil citation as opposed to, arrest and put you in custody. So I'm not sure that the denominator of arrested children, I think really what we want to take a look at is kids that are charged that are either cited versus arrested, or, so that the number is kids cited and arrested and what percent are cited, because over time we hope that more and more kids are going to be in a civil citation and or diversion. So you can be diverted. Civil citation in essence is a diversion from arrest, and then the rest of the diversion stream is around diverting you so that your charges eventually kind of disappear. Right, so it could be restitution, it could be community service, it could be all kinds of different things that go into that diversion continuum. So I'm not sure there's a lot of specificity power, but since it's a development agenda, I think what we'd need to do with that one is get much more clarity around what do we mean. Civil citation versus arrest is a good thing, and then diversion upon arrest is another good thing.
Yeah, the data point that is tracked, because we used to track it in Duval, was the percentage of kids eligible for civil citation that actually received a civil citation. And
as opposed to being arrested.
Right, and so we were in the 20s. So most of our kids were getting arrested when they could have been given a civil citation. And the intervention was to elect a new state attorney. And so when we elected a new state attorney, we went from worst to first. So that's kind of how, that's been my experience with that data point. But that's really what you want to know is the kids that are eligible for a civil citation, what percentage actually get one versus.
Well, you want both though, and then of the ones that are arrested, which ones get offered a diversion program that can make the arrest go away, which for employment in the future is a big deal.
Right.
So.
Can you go roll over to the next slide?
No, a commitment program is not the same thing as a diversion program.
Right.
By a long stretch. And there are fewer and fewer of those actually being used. I suspect we could learn a lot on that from Chief Jones and all of the Reichert House stuff, because that is one of the earlier diversion programs for kids, and it was an intervention program. But I think some of that data may be more available than we think.
That was the last slide.
Okay. You guys have any other comments? And then I'll kind of go over our tasks. Okay, so we will take this information and then reorganize the PowerPoint/report reflective of this idea of the dashboard versus story indicators. We'll put this together so that I can do a trial run. When is our next board meeting, Colin?
The first. So not next Monday, but the Monday after.
Okay. So didn't they just meet last week?
Yep.
Okay. So then we'll work over, I'll work over Monday and try to get the stuff reorganized the best that I can. And then Sherry and I will meet. Sherry, I don't know that we want to waste everybody's time finding the time to meet, but we need to get that meeting done probably Tuesday or Wednesday next week.
Yeah, absolutely.
And then once Sherry and I meet, we'll send everything out to the group. When is the board expecting us to present this, Colin?
Monday. But I guess I got 2 board members on here. What do you guys think? Are they expecting to see it Monday or?
I think so. I think that's the expectation.
Yeah. It's a lot to do.
Yeah,
Well,
and I
that's why
think
I get
that's,
paid the big bucks for this, I guess.
thank God for Maya.
So then we'll send something out to you guys on Wednesday.
Yeah. And if you do want, I mean, Colin, what's the time frame if we needed to have a quick meeting for a run through of the PowerPoint, are we still in time to notice that? If we wanted
Yeah,
to do something Friday?
Yes, we can do that.
Do you want to do that, Herman? Do you want to try on Friday to set up a run through?
I would appreciate that if you guys are willing to tolerate the extra time. I mean, I always value y'all's feedback.
That would make it the 29th of May, and I'm perfectly happy to do that. You've put in such an amazing amount of effort. We all owe you a huge debt of gratitude, so I'm happy to give you the time to provide feedback and anything you need.
When are you thinking, Herman? The 29th at what time?
I was thinking of just kind of keeping it at the same time, if that works for everybody. One, if that doesn't work for folks, is there other time on Friday that would work better?
I'm wide open, so I will go with whatever is good for everybody.
I could do 3 o'clock. I've already scheduled another meeting on the 29th at 1, so.
Okay, 3 o'clock works.
Well, I don't want to be the only one driving this if it doesn't work for others, but the rest of
Well,
the
it
day
just
is
gives me a
full
few
up
more
until
hours
3 o'clock.
That gives me a few more hours to prep before I do the presentation with y'all, so I'm perfectly fine doing it at 3 as opposed to 1.
Does that work for others? Does it work for Maggie and Kate?
Yep.
And
Yeah,
I'm wide open.
works for me.
all right,
Works for me too.
okay.
Okay.
My calendar.
All right, well, thank you all. Is there a motion to adjourn?
I move we adjourn, and with thanks to Herman for an amazing amount of work, and for Maya too.
Yes, Maya and Herman, thank you. And I second.
All in favor?
Bye.
Bye. Have a good 3-day
All right.
weekend. Keep your social
Yep.
distance.
Bye, everyone.
Bye, everybody.
Thank you all.
Bye.
Bye, guys.